Understanding lung disease, types, causes, and symptoms. Welcome back to our YouTube channel, where we explore fascinating topics related to health and well-being. Today, we're delving into the world of lung disease, discussing its various types, causes, and symptoms. So, if you're curious about the intricacies of these conditions that affect millions of people worldwide, you've come to the right place. Let's dive in. Asthma. We begin with asthma, a chronic condition that affects the airways. Asthma is characterized by inflammation and narrowing of the air passages, leading to recurring episodes of wheezing, coughing, chest tightness, and shortness of breath. It can be triggered by various factors such as allergies, exercise, or exposure to irritants. Though, chronic obstructive pulmonary disease (COPD). Next up, we have chronic obstructive pulmonary disease, or COPD. This progressive lung disease encompasses chronic bronchitis and emphysema. It is often caused by prolonged exposure to harmful substances like cigarette smoke or occupational pollutants. COPD results in difficulty breathing, persistent cough, excessive mucus production, and reduced lung function. Pneumonia. Pneumonia, a common lung infection, is our next topic. It occurs when the lung tissue becomes inflamed due to bacterial, viral, or fungal infections. Symptoms of pneumonia include cough, fever, chest pain, and fatigue. It's important to seek medical attention promptly as untreated pneumonia can lead to serious complications. Pulmonary fibrosis. Now, let's explore pulmonary fibrosis, a condition characterized by scarring and thickening of lung tissue. This can be caused by various factors, including exposure to environmental toxins, certain medications, or underlying diseases. People with pulmonary fibrosis experience reduced lung capacity, shortness of breath, dry cough, fatigue, and weight loss. Lung cancer. Lung cancer, a well-known but significant topic, is the next focus of our discussion. It is a type of cancer that starts in the lungs, commonly associated with long-term smoking. However, non-smokers can also develop lung cancer. Symptoms include persistent cough, chest pain, shortness of breath, coughing up blood, and unintended weight loss. Early detection and treatment are crucial for better outcomes. Tuberculosis (TB). Moving on, let's shed light on tuberculosis, or TB, an infectious disease caused by Mycobacterium tuberculosis. TB primarily affects the lungs but can also affect other organs. It spreads through the air when an infected person coughs or sneezes. Symptoms include persistent cough, chest pain, coughing up blood, fatigue, weight loss, and night sweats. Prompt diagnosis and appropriate treatment are vital to prevent the spread of TB. Cystic fibrosis (CF). Lastly, we explore cystic fibrosis, a genetic disorder that affects the lungs and other organs. It results in the production of thick, sticky mucus, leading to recurrent lung infections, persistent cough, wheezing, and poor growth in children. Early diagnosis and management are crucial in improving the quality of life for individuals with CF. There you have it, a comprehensive overview of various lung diseases, including asthma, COPD, pneumonia, pulmonary fibrosis, lung cancer, tuberculosis, and cystic fibrosis. Remember, if you experience any respiratory symptoms or suspect you have a lung disease, consult a healthcare professional for proper diagnosis and treatment. Stay informed, take care of your lungs, and we'll see you in the next video. Don't forget to like and subscribe to our channel for more engaging content. Until then, stay healthy.